Aaron, you want to introduce yourself? Because Krissi, you want to introduce yourself? These are people, most of them, they don't, well, I know most people know you, Don.
Oh, I don't know about that.
But
yes, I'm Don Roy. I've been in insurance business for 45 years. I started the year before Medicare. So I'm an old fossil. Also, I started a little political company this year called, last year now, ObamasWrong.org. So I pray for him every day. I want him to be the most successful one-term president we've ever had. So,
that was good, that was good.
Unfortunately.
well, and I'll have a new website coming up that it's Spender in Chief.
Spender in Chief, okay.
We'll be launching that in a couple of weeks. Go through all of the stuff that's really money that's been just thrown away. Thrown away. Just walk right there, throw it at the street.
Yep.
Give it away for votes.
Yes.
Well, not just
Well,
that.
that doesn't even bother me so much because hell, they all do it in that respect. But when it's just, I mean, you walk out and it's just gone.
Just gone, that's
I
exactly
mean, it's
right.
like down there in Bamberg, down there, they lost $2 million of stimulus money that they can't find. And you multiply that by how many school districts and stuff is there around the country? It's like a year ago, remember when Joe started Joe for Jobs? And he was over at the West Metro at the
Women's
municipal building over.
yeah.
And he and I was talking because I thought what we need to do, we need to have a moratorium on income tax collections for at least 6 months. Let the money get back in people's pocket and have some money to spend, which would accomplish two things. Then we realize how much the government's stealing from us.
There you go.
And it's our fault. And then we might do is we might wake up a little bit. But anyway, so I mentioned that talking to Joe Wilson. I said, the states can't print money and the federal government. And he said, Don, we don't even have to print it anymore. They do it by electronic transfer.
Yep.
And then that was the week that I found out that money was missing down in Bamberg. So anyway,
Electronic transfer. Sounds good.
Yeah, a lot of that TARP money,
they don't know where it
don't know where it went. Just,
probably in some bank out in the Bahamas or something.
Transferred it to the wrong
yeah,
bank.
Yeah.
they can play that hoodoo with it, man.
Somebody got
You know,
Pretty good.
that TARP money, man. All these houses that being repossessed.
My name's Krissi Szencher. Nice to meet you. I'm in healthcare administration.
Okay.
I've been in healthcare for over 10 years.
Okay.
Which hospital?
I worked for a smaller company, Palmetto Orthopedic, and then went on to Lexington Pulmonary Critical Care with Dr. Elton. Deanna Constable, she's at Orthopedic, she's a good friend of mine. They made her try to follow the healthcare.
The bottle.
But
Have
we
you
won't get
been to
into
the
that.
have you been to the meeting in South Carolina Small Business Chambers putting on this and that yet?
I have once years ago when Crystal
they're
Miller was.
going to have 2 in September.
Okay.
Here in, I called yesterday, but I don't have the dates in here with me, but you can call them and get the dates. It's going to be, both of them's going to be at, one will be at the Chamber, West Metro Chamber.
Okay.
And another one will be at the Harbison County for Middle Texas.
Yeah, I'd like to go. I actually am just a couple classes away from my master's
Oh,
in
good for you.
healthcare administration.
Good deal.
Now I'm transferring on for a PhD, but I've been going to school for years. Yeah.
Wow, for you, well.
Yeah. But
Where do you go to school?
I go to school online, University of Phoenix.
Phoenix.
But we'll be transferring to USC next year though. But yeah, I try to do any kind of classes I can, any kind of conferences, seminars. I actually was on the South Carolina School Board bond referendum a few years ago.
Well, any information that you can give me that you hear about Medicare and stuff, Medicaid, before I get, just like last year when they disenrolled all the poor Medicare,
Yes.
Medicaid people in December, they didn't even know it happened.
And they didn't.
And we can't even find out who to blame.
No, and it's a shame because so many, Americans on Medicare, I mean, they come into the offices and they have no idea what's been done. They give you their red, white, and blue card and they think this is
And they're not
what
in that anymore. They're in a
No.
Medicare Advantage plan, which is fine.
Or an
which is,
HMO.
or an HMO. Well, it's not an HMO, it's actually in Lexington, in Lexington County. But that's something I just found out yesterday. New federal legislation if a company, once two HMOs get into a county, then it'll be on private fee for service.
Private fee for service, right. And I think those are a whole lot better.
Yeah.
Anybody takes the private fee for service. Advantage plans are a lot easier. Once you get into the HMOs, you know, that's when it gets a little bit more
But
complicated.
that's exactly what's gonna happen. That
Right.
Medicare, Medicaid is all gonna eventually go to HMOs.
That's right.
Because that's the only way that, one of the ways that cut the cost down, you're gonna have a gatekeeper there, and you're gonna, and eventually it's gonna be some accountant somewhere making the healthcare decisions as
Hey, don't
opposed
be
to the
looking
doctor.
at me like that, Don Roy.
I wasn't looking at you.
Oh, I thought you were saying
In
that.
No, I didn't say
September,
doctor. Accountants, I mean, I wish we had some better ones in Washington.
I do too.
They're
We
doing
go up
voodoo,
there.
they're doing voodoo math up there.
Now they're gonna cut the Medicare by 21%.
And the thing of it is like, we've lost, and you're aware of this, in the last 4 years, we've lost over 1,000 Medicare providers within 150 miles of Columbia.
And it's gonna continue to
You
grow.
know, yeah, because, well, it's like, I know I had 9 docs that went 180 days last year, got not one dime for Medicare reimbursement.
Yep, that's why they don't take it.
Well, I mean, it can't work for free.
No, and then you get into the surgeons, because you have, you know, orthopedic surgeons who do 2-3 procedures, Medicare wants to pay one, so you're looking at a $12,000 surgery, they're getting paid $1,200. You've got the same thing for pulmonary, you know, rheumatoid arthritis.
And even with
They
the
do
mumbo
2-3
jumbo,
procedures.
and you probably, do you know who owns the rights to the DRGs? I'm gonna tell you something that's gonna hurt in your stomach. In the healthcare bill, it came out, okay. The AMA owns the rights to the DRGs. They were, a long time ago, a sweetheart deal they gave them. Every time a claim is filed, someone pays to the American. That's the reason they don't care that they've got 17% membership now. Their revenue for less than, there's about 400 employees total. They collected over $500 million last year. Now,
The AMA?
the AMA, they own, well, you know what DRGs are? Do you know what the DRGs, diagnostic related groups, okay? You have to have those codes before you can file a claim.
Right.
Now, with Obamacare, the minimum they're gonna get is 1.6 billion.
Minimum.
That's the minimum. Now, where do you think that's coming from?
Oh, yeah.
Right out of the pocket of the taxpayer. And the guy who's the president of the AMA in South Carolina didn't even know it.
He didn't even know it.
And quite by accident, I find out.
Wow,
It's just sickening.
it is.
Yes, it is.
I mean, those should be in public domain. Nobody should pay for them.
No.
You notice, you probably do, because you're regular. The women today,
I know.
usually where it's
The
usually all
first,
men.
the first time I think it was just myself and you.
Yeah, and all men.
I was here.
What do you think's gonna happen with
That's
TRICARE?
my friend Sandra.
Now,
Yeah,
I
that
will
was-
say,
yeah.
not a lot of providers like
And
TRICARE.
did it,
I have TRICARE.
Personally,
Today.
I love
I
TRICARE.
know.
We want to do the best
Number
go
one,
back.
it is. They pay on time, they pay properly. They will, you know, they'll approve services that they should. TRICARE, and even though they follow the Medicare allowable on their paying wise, they do pay, I'll tell you, they pay timely, you know, within 30 days. They pay properly, and they have a website that you can actually navigate through. As opposed to Medicare, you know, you go on the Medicare website, you have to go to 5 different links
Oh, yeah,
just to
okay,
find
but-
an allowable code.
There's
As
nothing
for
here.
TRICARE, you can go on, you can plug in a code and it tells you the allowable.
I told my
You can
kids,
put in your claim
don't-
as easy
as
as
long as
can
I don't
be,
do that.
and they'll pay you in 3 days if you put in your claim online.
Why do some doctors not like TRICARE?
You know, I'm not sure.
Sometimes I'm
There are
limited.
doctors in Lexington Medical, Lexington Family Practices, they try to steer clear of TRICARE.
because they had such a bad experience with Champus.
And that's it.
That's
Right.
what it was.
That was years
Now,
ago.
Champus,
right.
I will say Champus, on the other hand, they're a little bit more complicated. It
Right,
takes
that's
them
what
longer.
I'm saying, and so they had that bad experience, and they just steer clear of all that.
Right, and they don't understand, you've got Champus VA, that's a totally different, you know, they have their own processes.
Well, and there's two
as opposed to
TRICAREs too. There's TRICARE and
Prime,
there's TRICARE for
TRICARE
life.
Standard, and TRICARE for Life.
Yeah.
And TRICARE for Life, which is secondary to Medicare, they pay on time, and they pay great because
Yeah.
Medicare now
Oh, you missed
crosses
it.
over the claims electronically. So providers now don't have
There's
to
the guy I've
submit
been
their
looking for.
secondary claims. Medicare